let's move on to the examination of sensory system. So coming to the introduction, generally the routine neurological system is examined under the following headings in clinical practice. So to examine neurological system, the following headings we have to complete, like examination of higher functions, examination of sensory system, examination of motor system, including reflexes, and examination of cranial nerve. So all together comes under routine neurological system examination. Right now, today I am going to take the examination of sensory system. That too, I am not including special senses like vision, hearing, all those special senses I am not taking today. It will be included in the examination of cranial nerve examination. Okay, today exclusively you are going to learn about examination of sensory system. All of you take a pen and paper and be seated. Something you have to note it down in the, because you have to come prepared after reading these, and you have to prepare one chapter column and prepare with your checklist. So that I am asking you to take the notes. So coming to the examination system, we are going to examine all these. Number one, tactile sensibility. Under this, we are going to check fine touch, pressure, tactile localization, and 2 point tactile discrimination. So under tactile sensitivity, we are going to check fine touch, pressure, tactile localization, and tactile discrimination. Vibration sense. Then we are going to check proprioception, the sense joint sense. Under this proprioception, we are going to check position of the joint, sense, and kinesthetic sensation. Kinesthetic sensation means appreciation of the movement of the joint. And then we are going to check pain sensibility. Under this, superficial pain and deep pain. Okay. Then we are going to check temperature sensation. Under this, cold and warm sensations separately. And one more test, stereognosis. And one more test, Grafesthesia. I'll be dealing all these things in the next coming slides, one by one. So before doing this particular examination, there are some prerequisites. What are they? Before starting the procedure, explain the nature of the test to be performed to get the full cooperation of the subject. So explain the procedure properly and get the consent. Okay. Ask the subject to close the eyes while examining to avoid visual prejudice. So with the visual sense, they will identify all the sensations. So remove that visual sense. Ask them to close when you're examining. Test different forms of sensations bilaterally, comparing the corresponding points on both sides of the body according to the dermatomes. What do you mean by this? You have to check bilaterally on the similar point, corresponding points on both sides, and you have to compare, and you have to check according to the dermatomal supply. And also You have to check negative testing. What do you mean by negative testing? Negative testing is a false positive test. You are not going to test, so you are presenting a false positive test. You are applying a false positive test to the subject, and the subject has to tell you are not doing the test right now. This is the negative testing. During sensory examination, we have to do negative testing compulsorily. It is to confirm the validity of the test procedure. Otherwise, they will deny. They'll say, yes, I can perceive. Simply they'll say, I can perceive. Or simply they can say, I don't perceive. So to avoid this, we have to do negative testing. Okay. So what is dermatomal rule? What is dermatomes? A dermatome is an area of skin that is mainly supplied by afferent nerve fibers from a single dorsal root of spinal nerve, which form a part of spinal nerve. So this is the dermatome. So it is an area of skin that is supplied by the spinal cord dorsal root. For example, in the diagram, I have given so many numbers. Okay, it is given as C2, C3, C4, C5, C6, C7, C8. You can see in the diagram, in the picture. So this C2 means this is the area supplied by C2 spinal cord level. Cervical to spinal cord level. And if you take the forearm, you can see C6, C7, C8. So this entire area is supplied by C6. You can see this yellow color. This entire area is supplied by C6. So any loss of sensation of any sensations, may let it be pain or temperature or simply touch, that indicates the lesion is in the C6 level of the spinal cord. So it is very, very important to check according to the dermatomal rule to identify the root of lesion. Where is the exact lesion we can identify by comparing with the dermatomes. So we have to check according to the dermatomes. If you complete C6, go to C7 and compare with the C7 of the opposite side and compare whether it is decreased, whether it is increased. When compared to right side, what happens to the left hand side? So that is the importance of the dermatome. So by examining all the dermatomes, we will come to know that this is the area of lesion. And before going to the sensory system examination per se, I request you, all of you should know the dermatomal supply of the sensory nerve. See in the cuff L5, how much it is supplying, S1, where it is supplying, L3, where it is supplying. So this is a must to be a doctor. Okay. So let's move on to the examination. The aim of today's examination is examination of sensory system of the given subject. Take the personal data of the subject, fill the columns, name, age, gender, and occupation. So complete filling the personal data of the subject. Okay. Next. Do general physical examination. Find out the conscious level, whether conscious for the subject, it looks not so important, the conscious level. If the patient is there, it is a must because you are taking a neurological examination. So the level of consciousness is very, very important in the patient. And ask the orientation to time, person, and place. What do you mean by orientation? If you ask what is the time right now, the person will say now around 9:45. So this is the orientation to time. What do you mean by orientation to person? You will be asking who is this nearby person, their relatives will be there. So who is this? How he is related to you? So that is the orientation to person. And orientation to place, you have to ask, where are you right now? Right now I am in Rajeshri Medical College. So like that, you have to identify the orientation of the subject or the patient to time, person, place. Actually, these two comes under higher functions. Higher functions will be dealt later to you. I simply taken these two because these two are very, very important for a general physical examination. That's why I have included these two under this other things. So many things are there to examine under higher functions. You'll be knowing later. And look is built, whether he is moderately built, ill built, or well built. Look is nourishment, moderately or ill nourished or well nourished. And pickle, you will be knowing already, palo, icterus, clubbing, cyanosis, lymphadenopathy, and peripheral edema. We have already dealt about this, the importance of this. We have dealt already. So take a simple examination, but you should not miss this. Okay. And then record the vital signs. Under vital signs, you will be checking pulse rate, you will be checking respiratory rate, blood pressure and temperature. So this is a simple general physical examination and it has to be done before going to the proper examination per se. So now I told you to take down the pen and paper. Now you have to take down this tabular column. There are three columns: test, observation and inference. Right now you complete the tabular column as it is, but when you are coming to the college, when you are going to see a subject, this observation column, inference columns, you have to fill at that time. This is for the reference. Whatever I have given is the reference. You have to take this tabular column as just like that. But when you are coming to the college, when you are given the subject to check the sensory system examination, your observation and inference should be left empty. And after doing the completion of the test only, you are going to fill the observation and inference columns. Yes, students, complete taking. So what we are going to do first, the test. Under the test, we are going to check fine touch, and under observation, we have taken two subdivisions. You are going to check right hand side and left hand side. So for fine touch, under the observation, able to perceive equally on both sides. What is the inference? The fine touch is carried by dorsal column tract. So dorsal column tract is intact. Any one of you mute yourself and please come into the line. Hello? Hello?
Yes, ma'am.
Any one of you please come mute yourself.
Hello. Yes, ma'am.
Yes. So you have to tell me what are all the sensations that are carried by dorsal column tract pathway.
I don't know, ma'am.
Yes. Okay. Anybody else who knows the answer? Come.
I can say that it's fine touch, pressure,
Yeah.
and tactile localization.
Okay. Okay. So it is easy to remember, students, all the sensations except pain, temperature, and crude touch are carried by dorsal column tract pathway. Fine touch, pressure, tactile localization, tactile discrimination, vibration sense, position sense, stereognosis, and grafesthesia. All these are carried by dorsal column tract except crude touch. The crude touch is carried by anterior spinothalamic tract, and pain and temperature sensations are carried by lateral spinothalamic tract. Please remember this, easy to remember. All sensations except root touch, pain and temperature are carried by dorsal column tract. Okay, so take this, take the tabular column, complete the tabular column fast. Second sensation we are going to check is root touch. Write down able to perceive equally on both sides, and inference is anterior spinothalamic tract intact. Next test is pressure. Write down able to perceive equally on both sides, dorsal column tract intact. Next, tactile localization, able to perceive equally on both sides. That inference is dorsal column tract intact. I'm going to change the slide. Have you completed taking the tabular column? Have you completed taking the tabular column? Yes. Okay. I will change the next slide. Now the test is tactile discrimination. Under tactile discrimination, write down the side headings, fingertips, arm, dorsum of hand, forearm, back, and foot. I have written in the observation in millimeters. Now to take the recordings in millimeters and fill the column accordingly. Under fingertips, how much it has taken, under palm, how much the distance it has taken, how to fill. In millimeters, fill on the right hand side and left hand side. The inference is that yes, I know that it happens. Vibration sense. The these outside of the heads have taken 158 heads under the observation sense. Next, the observation sense. Next, pain sensation. The pain sensation. The observation sense. The tract. Next, under these tract. Tract that kind of your right identity That is A. That is completed taking tabular column. Now write down the system examination dash that that blank well, I wanted any kind of time even of guys I'll be marks for yes. The one or two please come into line.
Excuse me, ma'am.
Yeah.
Ma'am, we are not
Yes.
able to hear you, ma'am. Your voice is breaking.
Since which slide?
Ma'am,
Only
since
the
the
tabular.
second slide, the tab from the tabular column slide, the second slide, ma'am.
Okay. Now am I audible?
Yes, ma'am, you are audible now.
Okay. So you have taken, you have concentrated on the tabular column. You have taken the tabular column.
Yes, ma'am, we have
And
taken it down.
yeah. So now
Yes.
there is no breakage, right? I am audible
No, ma'am.
right now.
Yes, ma'am, you are.
Not I am audible. Okay. So because now I am going to the examination per se. So I wanted to be clear that my voice is not breaking. Okay.
Yes. Yes, ma'am. Yes, ma'am.
So all of you, I think all of you have taken the tabular column and till the report you have taken the notes, right? Now I will be moving on to the examination per se. So give the general instructions to the patient, subject here. We are going to check the subject. So make sure that we are going to check the subject. And that's why my tabular column is, I have completed my tabular column, both the observations and inference, thinking that the subject is a normal person. So that's why I told you not to fill the second and third column when you are coming to the college, when you are given to test the sensory system examination. Yes, ma. May I know your name? JS.
Ma'am, Jueria, ma'am.
Okay. So my instructions, all of you, I think it is clear to you, right? Right. Yes.
Yes, ma'am. Yes, ma'am.
Yeah. Okay. So, general instruction to the subject, inform the subject about the procedure and obtain the consent, and stand on the right side of the subject and give proper instructions. And ask the subject to close the eyes. And now I wanted to tell one more thing, that area, wherever you are going to test, that area should not cover with the clothes. So forearms, they have to remove the clothes on the skin where you are going to test. And ask the subject to say, whenever he perceives the sensation, he has to say yes. When he is not able to perceive, he has to say no. Okay, while doing the test. So now the first sensation you are going to check is fine touch. To do this, you need cotton wool. cotton wool. With cotton wool, lightly touch the skin and note the response. So the subject will say, yes, I am able to feel the cotton wool. And if he is not able to perceive, he says, no. Okay. Next, repeat the same on the other side and compare. Repeat the same procedure in different dermatomal areas. So take a cotton wool, lightly touch the skin and note the response. You have to start with fingertips. Start with distal areas to proximal areas. Okay, better to start like that. Start from the fingertips, then go to the palms, then to the forearm, arm, like that. You have to start the exam. And every time when you are going to test the particular test, the person should close the eyes and he says, yes or no. You have to repeat on the other side and compare if there any degrees or degrees are same. And you have to complete the dermatomal areas in the exposed areas. Okay, next for the finding. This is the instrument on face hair aesthesiometer. In this instrument, you can see one hair which length can be visible. There will be a graduated tube. There is a protective cap, and the name of this is hair. Is the okay. Now I So one tray is we are not using, but we have the instrument at our college. This is the one tray is hair aesthesiometer. You can see one hair projecting. If you there is an adjustable knob here. You can adjust the length of the hair. You can make it short or you can make it longer. Lengthier distance, lengthier thing we can use for fine touch. If you make it shorter, it will be painful. So when you take this instrument, make it lengthier and check for fine touch, and you have to touch gently, keeping the instrument perpendicular to the skin. Okay, next. Next, we are going to check the crude touch. For this, you are not going to use cotton wool. You can use your fingertip or the back side of the pen of a pencil, the blunt object. Usually we can use a pencil, the back side of the pencil, the blunt. Now, like take like right, okay. Next team, touch, have to check your
Excuse me, ma'am.
yes, ma.
It is breaking again, ma'am.
Okay, 1 second. Okay, pressure, pressure. With the help of fingertips or blunt object, apply sustained touch on the skin and note the response. Here also you can use the fingertip, the person see, but you are not taking the fingertip immediately. You have to keep for some more time. Sustain touch. Okay, keep for some more time and ask him whether he is able to appreciate it. Repeat the same on the other side and compare. Repeat the same procedure in different dermatomal areas and repeat the finding. So, pressure sensation, you are using the finger tip or the back side of the pencil or pen. Okay. This is the algometer. Algometer, this instrument we have, or this right hand side instrument we have in our department, this can be used to check the pressure. This area we can keep perpendicular to the skin and we can identify. If you give more pressure, it will be perceived as pain sensation. So take care while you are using pressure algometer. If this is the blunt end, you can use this blunt end to check the pressure sense. But if you give for a longer period, you are going to sensitize the pain sensation. So make sure that you are not giving pain sensation. Yes. Next. Tactile localization. So for this, you have to use a tip of a sketch pen. With the help of a tip of a sketch pen, touch a particular point on the skin and ask the subject to touch the same point with a different colored sketch pen. So what do you mean by this? You give the subject one sketch pen with a different color and you take one sketch pen. With the tip of the sketch pen, touch one particular area. Ask him, close his eyes, and he has to touch the same area where you have given the stimulus. Oh, so with the help of the another sketch pen, he will touch the same area where initially you have stimulated. Then his tactile localization is good. Okay. With the same on the opposite side and compare. Repeat the same with the different dermatomal areas and report the finding. Students, is it any doubt? Now my voice is clear?
Yes, ma'am, it is clear.
Yeah, if I use earphones, my voice is coming clear, but I am not able to hear you. That's why. Okay, ma'am. Until there's any doubt, can I move on to the next examination? Can I move on to the
Yes,
next
ma'am.
examination? Yeah. Have you understood tactile localization? You are going to give you are using two pens with separate color. So when you tell the person, he has to point the same area where you have stimulated. That is localization, ability to localize the exact point of stimulus. Okay. Next, we will move on to the next. Now we are going to check the tactile discrimination. Tactile discrimination is the ability to distinguish two simultaneously applied stimuli as separate, and you have to note the observed value. How to check? I will tell you. Repeat the same procedure on the other side and compare, and repeat the same procedure at different areas and report the finding. So what do you mean by tactile discrimination? Anybody? Can you tell what is tactile discrimination? I want one more student who can answer for this. Tactile discrimination. What is that? Sensory system over? No. Theory part. Yes. What is tactile discrimination? No. Don't know.
Is it like discriminating between like different type of touches, like fine touch and crude touch?
No. It is not between two different sensibilities. It is the same two. Take two pointed ends, keep aside. Okay, they have to touch simultaneously. So you are keeping two stimulus at the same time. The person is able to perceive it as a two stimulus. If they are very close, will they perceive it as a single or two separate stimulus? You are keeping two simultaneous stimulus which are not separated at all, and you are touching at the same time. Will you feel that as a single stimulus or two separate stimulus? Yes, ma?
As a separate stimulus.
If it is closely applied,
If
they
it's
are
very close,
yeah,
if it's very closely applied, you can't.
yeah, exactly. There should be a minimum distance between between the two stimulus. There should be a minimum distance to appreciate them as a two separate stimulus. Yes. Yes.
Yes, ma'am.
Yes. That minimum distance only we are going to find out. That stability is the tactile discrimination. The same thing we are using for vision also, visual acuity. So it is a minimum difference between the two objects. So you can see them as two separate objects, though they are very close. You got it? Have you got it?
Yes, ma'am.
Yeah. Yes. That is a tactile discrimination. I think my voice is not breaking right now. Am I clear?
Yes, ma'am. You're clear now.
Now, this is the instrument we use for the tactile discrimination. This is named as Weber's compass aesthesiometer. Weber's compass, it looks like a compass you use for mathematics. Okay, this is the Weber's compass aesthesiometer. In this diagram, you can see graduated numbers 0, then 5 mm and 10 mm, and each small is 1 mm. So there is an adjustable screw here, and this is the ends of the limbs. So adjust these limbs to minimum and apply, and you find out whether the person is able to perceive it as a single stimulus or two stimulus. Clear? Start with 1 mm, then go on to 2 mm. This is, you can see 0 to 5, each is 1 mm, 1 mm, 2, 3, 4, 5. So start with 1 mm and just check. For example, I'll show in the diagram. So this is the examination of tactile discrimination. You can see simultaneously you have to keep the two limbs together, the fingertips, and ask him whether he is able to perceive it as single stimulus or 2 points. Is it clear, students? Is it clear? Yes?
Yes, ma'am.
Yeah. So once you complete the fingertips, you examine the opposite side and move on to the palms and check the opposite palm. Like that, you have to find out what is the 2-point discrimination. And actually in the fingertips, the 2-point discrimination is 2 mm. And as you move on to the proximal areas, the distance will be more. Okay, the minimum distance between the 2 points is 2 mm in the case of fingertips and 5 mm in the case of palms. And as you move on to the back of the person, he may need at least 5 centimeter to 6 centimeter to identify them as separate points. Okay, that means we have receptors, more receptors in the fingertips, more receptive fields are there, so that you are able to identify it as a two separate points. Am I clear? Can I move on to the next test? Yes.
Yes, ma'am.
Next is the vibration sense. So for this case, vibration sense in the sense it is a buzzing sound. I'll use the microphone. My headphone. So vibration sense means it is a buzzing sound. Okay, as if something is moving, vibrating on your skin. For this to test, you need a tuning fork of 128 Hz. There are several heads tuning forks exist. One is 128. You have 256 heads, 512 heads. Those higher ends, 256 and 512 heads, we use for audition, hearing. For hearing, we use that tuning fork. For vibration sense, less the heads, vibrations and the feeling will be better. So for this test, we are going to use a tuning fork of 120 heads. Now what you have to do, I'll show the diagram. This is the tuning fork. First I'll show the diagram. So this is the tuning fork. I have, these are the prongs. Okay, these are the prongs. This is the stem and this is the base. Okay. So you have to allow these prongs to vibrate. If you tap on the hypothenar eminence of your left hand, you just tap with the prongs. It will start vibrating. It will start vibrating. Make the tuning fork to vibrate by striking it against the hypothenar eminence of your hand. Hold the tuning fork at the stem. Don't hold at the prongs. If you hold at the prongs, they will stop vibrating. So make sure that you are holding the tuning fork at the stem, not at the base, not at the prongs. Yes. Then immediately place the base of the vibrating tuning fork on the bony prominences of the body. Any bony prominence. You can start with a radius. You can start with the your elbow joint. Any bony prominence. Okay. You have to place the base of the vibrating tuning fork. Ask the subject to report when the vibration ceases and compare with yourself. That is, once he says vibration is ceased, you have to keep on the same bony prominence and feel whether vibration you can feel. The examiner has to feel it and repeat on the other limb and compare. Repeat the same at different bony prominences and report the finding. So this is the tuning fork. I have taken tuning fork of 120 heads. This is the prongs. This is the stem. I am going to hold here. I will make the prongs to vibrate. I will keep the base of this tuning fork of 120 heads on the bony prominence like this. Any bony prominence, upper limb and lower limb, you have to take. And once it says it is stop, you compare with your own jaw, bony prominence, and just check whether it is seized or is still vibrating. If still vibrating for your condition, that means the person is vibration sense is decreased. Yes. Now the questions. Yes, tell me, students, is it clear? Is it clear?
Yes,
Hello?
ma'am.
Yeah. So vibration sense, any doubt? Can I move to the next test?
Yes, ma'am.
Now, so we are going to check the proprioception. Proprioception is the joint sense. Move the subject's small joint and ask to recognize the movement. For example, you have to take small joint, finger phalanges. Take the phalangeal joints and move to right or left or to up or down, whatever the possible movement, flexion, extension. And then ask the subject to recognize the movement, whether it is flexed or extended. And ask him to imitate the same movement on the other limb, other joint, same joint on the other side. Repeat the same on the other side and compare. Repeat the same procedure at different joints and report the finding. Now I'll show you what we are going to see. In this diagram, what the examiner does, he is fixing the joint and moving the joint to flexed position, extended position, and the subject will tell whether it is extended or flexed. That is one thing. He will identify the movement. Second thing is he has to do on the opposite side by himself whatever the examiner does, moving the toe joint either to flexed position or extended position, whatever right hand side is there. So this is the imitation of the movement. Yes, students, is it clear? Is it clear? Any doubt in position sense? Hello? Any doubt in position sense?
No, ma'am.
Yeah, that is the make sure that the subject is imitating. One test is he has to imitate on the opposite limb. One test is he has to tell whether it is extended or flexed or turn to right side or move to left side. Okay. Next, I will move on to the next test. Pain sensation. For pain sensation, explain the subject properly that you will be eliciting pain. Pain is a painful stimulus. Definitely the subject will not cooperate. So separately ask the consent. And there are two, and tell him that you are not going to harm. You are not going to harm. There are two components, superficial pain and deep pain. For superficial pain, what you have to take a pin, head pin, and lightly prick over the skin and note down the response. Repeat the same on the other side and compare. For deep pain, what you are going to do, you have to squeeze the Achilles tendon. Achilles tendon present in the ankle joint. Just squeeze it. You can squeeze it because you have already got the consent that you are not going to harm. Gently squeeze the Achilles tendon and compare and report the finding. Yes, this is the diagram of pain sense. Have you understood pain sensation? Have you understood pain
Yes, ma'am.
sensation? Yeah.
Yes,
Next
ma'am.
we will move on. Yes, good. Now we will move on to the temperature sensation. For temperature sensation, place two test tubes, cold and warm water, separately on the skin of the subject in all dermatomes and ask the subject whether he is feeling it as cold or warm. Repeat the same on the other side and compare. Report the finding. So this is the thermal aesthesiometer. It's one side we can fill with cold water. The other side we can fill with warm water. Celsius I told, for cold water we have taken 27 degrees Celsius. For warm water we make sure that it is 32 degrees Celsius. We should not give more coldest and hottest, because these receptors, then what will happen, the pain free nerve endings will be stimulated. So that's why I am specifically telling about the temperature in Celsius. So if you stimulate more freezed water, then pain sensation will be elicited. So make sure that you are not going to elicit pain, you are going to elicit cold and warm temperature sensations. So either we can use this thermal aesthesiometer, which looks like a T-tube. One limb we can fill with cold water, the other limb we can fill with warm water. Alternatively, you touch the subject skin with warm side and cold side and ask him whether it is warm or cold. You can use the test tubes like this. You can fill the test tubes with warm and cold water, and you can do the simultaneous. One time you keep warm, ask him whether it is warm, and change it to cold and ask him whether it is cold. Yes, students? Yes? Any doubt up to this? Any doubt?
No, ma'am.
Yeah. Next, we are going to move on to the stereognosis. Stereognosis is the ability to identify familiar objects. So, what you have to do, keep one familiar object in one hand of the subject. For example, give eraser, and in one hand, he has to close the eyes. By feeling it, by palpating it, he will tell you what is that object. So later you will be repeating, you are going to give keychain, or you have to go give some other object which is familiar. Don't give unfamiliar objects. You have to give him, the subject should know this is the rubber before. Don't show before. Eraser means everybody knows this is the eraser. Pen, everybody knows this is the pen. Keychain, everybody knows. Mobile also you can give. So ask the subject to identify, not using visual stimulus. He has to close the eyes separately with one hand. He has to feel it and tell you. Okay. And repeat the same on the other side and compare. Report the finding. So this is the stereognosis. And last sensation is graphesthesia. Here, what you have to do, draw alphabets A, B, C, D or 1, 2, 3 numbers over the skin of the back. Here in the photograph, I have shown you on the hand, but you use the skin of the back. Make sure that the clothing should not be there. And ask the subject to identify what alphabet you have written or what number you have written and report the finding. Okay. And in between, make sure that you are not going to test, and make sure that the person is not simply answering. Make sure if you are not giving the test, the person should tell, no, you have not given any stimulus. You are not touching me. You are not temperature sensation. You are not checking me. That properly he has to tell. If he denies, he is hiding something. Okay, so definitely you have to do negative testing randomly in between the test. So with this, clinical examination is got over. And any doubts up to this mark? Anybody? 2 minutes. Any doubt? Any doubt? We have checked the fine touch, crude touch, pressure, temperature. Any doubts up to this? Yes? Now you can ask me any doubts. Let me complete. So you have to know some definitions like stereognosis. It is the property by which familiar objects are recognized by touch alone, by feeling their shape, texture, and size without seeing them. This is the definition of stereognosis. And what is hypoalgesia? Decrease of pain sensation. Analgesia, loss of pain sensation. Hyperalgesia, exaggerated sensitivity to pain, so that a mild stimulus that was painless before now evokes pain. What is hyperesthesia? Increased sensitivity to touch. Paresthesia, altered sensation, abnormal sensation like pricking, numbness, crawling of insects. And anesthesia, complete loss of touch. Okay. With this, I have ended my class. Any doubts? You're most welcome. And my question is, what are called as cortical sensations? Which are all sensations called as cortical sensations? Students, don't leave the meeting. Your attendance again I will be taking, and from here onwards, please be in front of your laptop and join the meeting 5 minutes before the class, because we are taking one attendance before the class, and at the end of the class one more attendance we will be taking. Okay, make sure that you have attended the class. Yes, my question is, which sensations are called as cortical sensations? Any one of you? Abhinav, tell me the answer. Which sensations are called as cortical sensations? Abhinav. Yes, who knows the answer? Which
Ma'am, any
sensation?
sensations which require the functioning of the cortex, for example, Grafesthesia, Stereognosis, where we need to think what it is. Those are called
Yeah, very
cortical
good. Yes,
sensations.
very good. May I know your name, ma?
Rakshita, ma'am.
Very good. So some sensations, they need the cortical perception. For example, as you said, stereognosis. As you or you told about tactile discrimination, tactile localization. So and graphesthesia. These are definitely we need the cortex to identify these perceptions. Okay. Very good, ma. And so, any feedback, whatever, see, this is my very difficult to understand the practical classes. But anyhow, when you come to the college, definitely one more demo we will be giving. But by then, you should be familiar with the words at least. You should do by yourself. Okay, I'm going to do with this fine touch. I'm going to do this pressure sensation. So before coming to the college, please make sure that you know each and everything. You're familiar with that and start doing the examination. We are here to help you. Okay, but don't ask what is stereognosis. You should be knowing what is stereognosis and how you will elicit it. Clear? Yes. Clear? Any doubt?
Excuse me, ma'am.
Yeah.
Ma'am, I wanted to know how we should be doing the negative testing exactly.
Yeah, negative testing, you're not going to, for example, take fine touch. With the for fine touch, you're testing with a cotton wool, right? A particular finger and tip of the cotton wool you have taken, you're asking him whether you're able to feel it or not. For negative testing, you are not going to keep the stimulus. You're not going to keep the stimulus, but you're asking him. Now you tell me what sense are you feeling that sensation? You're able to understand. For
Oh,
example,
yes,
I'll tell
ma'am.
in simple way. You have completed 2 to 3 areas. Already you have completed 2 to 3 areas of your fine touch. Suddenly, in one particular area, non-tested area, you are going to keep the cotton wool. You're not going to keep the cotton wool, and you are simply asking him, "Yes, tell me, are you feeling?" Yes. He has to say no. If he says yes, he is denying no.
Yes,
Yes,
ma'am.
got it. Yeah, that is the negative testing. For except for stereognosis, you can test for other sensations, negative sensation. I mean, negative testing. Yes,
Okay, thank you, ma'am.
receptors I didn't take. I am not going to teach you receptors. It is done. So you should be familiar with the receptors also. Okay, now I am ending the class. One student asked me in my mission class, "What is melanopsin, ma'am?" Is he there now, right now? One student asked me, "Ma'am, what is melanopsin?"
Yes, ma'am, I'm there.
Yeah, may I know your name?
I'm Amaresh.
Okay. What happened? Melanopsin really, I didn't go through at that time. I then found out that melanopsin it is not present in the normal books. Okay, normal whatever that in Genong, whatever the books I referred, it was not there, ma. I think I have given you wrong information. Now I will correct myself. What melanopsin they are telling? It is the pigment present in the retinal ganglionic cells. Okay, and it's similar way, rhodopsin and photopsin like rods and cones. This is one pigment present especially in the ganglionic cells, and they respond to blue end of the light spectrum. Blue end of the light spectrum, they respond to that wavelength, and they will be helpful in especially your biological clock. For example, during daytime, what is the vision? During the dim light, what is the vision? That biological clock is there in our body. So these melanopsin, these are excited with blue wavelength. and especially they will be helpful in the various reflexes like light reflex and day and night variations. Okay, now I'm sorry to give you the wrong information. Now I have referred. This is the melanopsin. Okay, because the basic books, Guyton and Ganong, it was not there. And Venkatesh Sudhakar, I don't think so. I have not seen that. Is it clear now, Amresh?
Yes, ma'am.
Yeah, okay. Any doubts regarding any classes of mine, please clarify. Now, be there. Recording download. I thought. Okay, thank you so much. If you have any doubts, I will clarify at any time. Okay.